there are more than 50 randomized controlled trials showing that exercise works. And we've known this since 2004, but it's still not common knowledge out there. And the type of programs that we work with in our studies, from which we see a 30% pain relief, that would be 1 hour sessions. It would be twice weekly for 6 weeks. That is 12 sessions. So with that we can see a 30% pain relief. And the type of exercise that we use, neuromuscular exercise, is different from aerobic exercise and strength training because they have different goals, you know. So when you do aerobic exercise, the aim is really to improve your cardiovascular output. And when you do strength training, you would like your muscles to get stronger, you would like to build bulk, really. But with neuromuscular training, you're really interested in improving the quality of how you move. And that is what we are working with. I think we have good reason to believe that starting with improving the movement quality is a good approach. Because if you improve your quality and you're then well aligned, you're in the position that you actually can do strength training without increasing your pain. We were struggling with getting the message out there in Denmark, but we were in the position that we had clinical guidelines actually saying that patients with osteoarthritis should have patient education, exercise and weight loss as their first treatment. But these clinical guidelines did not change clinical practice. And we started educating physiotherapists in Denmark in how to deliver treatment for osteoarthritis according to the clinical guidelines. So during a 2-day course, we taught them how to deliver patient education. We give them a PowerPoint and a manual and everything how to do it. We teach them about the GLA Neuromuscular exercise program, which is a sufficient dose, 12 sessions. And we also teach them about the value of evaluating the outcomes of what they're doing. So we have established an electronic registry where the patients, and to some extent also the physios, enter data so we can check on the effect of what they deliver in the clinic. And we follow the patient for 1 year. So now it's nearly 4 years later, and we have trained 800 physios in a country with a population of 5.5 million. And they have together trained and educated more than 18,000 patients that we have data from in the registry. And because we have the data, that is very powerful. We can show that this program seems to reduce sick leave. We can see that it reduces intake of painkillers such as paracetamol, NSAIDs and opioids. And we can see that we improve physical activity and function. We can see that we decrease pain. And actually it persists at 1 year, which is really, really impressive.